We are going to study the postnatal investigation, monitoring, and treatment in preeclampsia. Okay, basically, we have taken this from the NICE guideline about hypertension in pregnancy. Okay, so in a woman with preeclampsia who did not take antihypertensive treatment and have given birth, measure blood pressure at least 4 times a day while the woman is an inpatient at least once between the day 3 and 5 after birth on alternate days until normal if the blood pressure was abnormal on day 3 to 5. Okay, so while the patient is inpatient at least 4 times a day means 6 hours. Okay, and at 3 to 5th, third to 5th day at least once. Okay, and that depends upon the blood pressure as well. Okay, we can check it on alternative days if blood pressure which we checked at third to fifth day was found to be abnormal. In a woman with preeclampsia who did not take antihypertensive treatment and have given birth, start antihypertensive treatment if the blood pressure is 150 by 100 millimeter mercury or higher. 2010 recommendation. Okay, so there's certain group of women who did not take any sort of medications during pregnancy, but in the postnatal period, as we have said, that we have to check it. Okay, then in that case, if it is found to be higher than 150 by 100, or if it is, even if it is 150 by 100, then we have to start the antihypertensive treatment. Ask the women with preeclampsia who have given birth about the severe headache and epigastric pain each time blood pressure is measured. Okay, so we have to check the symptom as well. We have to ask from the patient about the symptom of preeclampsia, which we studied in the previous videos. In a woman with preeclampsia who took antihypertensive treatment and have given birth, measure blood pressure at least 4 times a day while the woman is inpatient every 1 to 2 days for up to 2 weeks after transfer to community care until woman is off treatment and has no hypertension. Okay, so previously we studied about the woman who had preeclampsia in pregnancy, but after delivery, those group of the women were those who were not on any antihypertensive. So we said that at least 4 times a day we will check when the patients are inpatient, and on third to fifth day we will check at least once, and if it is higher or if remains 150 by 100 or higher, then we will do frequent monitoring and start antihypertensive. But here we are discussing those group of women who are already on antihypertensive treatment and they are the preeclamptic women. So in them we have to check 4 times a day while the woman is in inpatient and every 1 to 2 days for up to 2 weeks after the transfer to community care until the woman is off treatment and has no hypertension. Okay, for the woman with preeclampsia who have taken antihypertensive treatment and have given birth, continue antihypertensive treatment. Okay, we have to choose appropriately as we discussed. Consider reducing antihypertensive treatment if their blood pressure falls below 140 by 90, and reduce antihypertensive treatment if their blood pressure falls below 130 by 80. Okay, so if the blood pressure falls below 140 by 90, we have to consider reducing, and we can reduce it further if the blood pressure falls below 130 by 80. Okay, and the choice we have discussed before that in the post-op period, in the we will postnatal post-op period, we will choose specific group of drugs. Now, this point explains which drugs needs to be taken. If the woman has taken methyl dopa to treat preeclampsia, stop within 2 days after birth and change to an alternative treatment if necessary for the choice of antihypertensive during postnatal period. If the woman was on methyl dopa like Altamid and she needs it even in the postnatal period as well, then we have to stop methyl dopa first of all. and then consider an alternative. Offer the women with preeclampsia who have given birth transfer to community care if all of the following criteria have been met. First of all, there is no symptom of preeclampsia. Blood pressure with or without treatment is 150 by 100 millimeter mercury or less, or blood test results are stable or improving. Okay, so if these three things are there, if these three criteria are met, we can transfer the woman to the community. Okay. Okay, now we have transferred the woman to community. We have to write a care plan for the woman with preeclampsia who have given birth and are being transferred to community care that include all of the following, which includes who will provide follow-up care including the medical review if needed, frequency of blood pressure monitoring, threshold for reducing or stopping treatment, indication for referral to the primary care for blood pressure review, and self-monitoring of the symptoms. These all have to be discussed with the woman. Offer the woman who have preeclampsia and who remains on antihypertensive treatment a medical review with a GB or specialist 2 weeks after transfer to the community care. Offer all women who had preeclampsia a medical review with a GB or specialist 6 to 8 weeks after birth.